Tan Sri, good evening. Ishwari from Malayville. I have two questions. With regards to the HSO, which you explained, I understand that you explained that after the first test, where they are tested negative, second test, they are tested negative, they can be free of the HSO. But we also do know that some people display symptoms only on the 5th or 8th day, or maybe even later. So aren't they still considered high risk and should be quarantined for 14 days? That's one question. Second question is, this is one of the questions which many social media users have asked. Why was the swab test and the quarantine order only imposed on September 27 when we already knew that Sabah was already a high-risk state with many cases before? Which means people who go to Sabah are already considered high risk. So some are questioning that there's been a little bit of lax in the SOP, which resulted in the 260 cases today. So these are the two questions. Thank you.
All right. The first question in regards to the testing. If the test RT-PCR result is negative and no exposure to a positive patient or no symptoms after, so the result probably, but the issuance of HSO is 14 days. If the result is on the 5th day, on the 6th day, then we examine the patient, individual, no symptoms, then we advise them to stay at home. In any time, for example, they have symptoms and then they have to contact us. So, and we advise them for self-regulation at home. But it's not a mandatory, but self-regulation at home. So we do have a few cases, they contact us because then they have symptoms, sore throat, etc. And straight away, we come to the clinic and then we examine. Although still asymptomatic, still negative, we test them, still negative. But because of the symptoms and negative, we admit them to the hospital because symptoms is almost like a COVID infection. So I think that's how we look into it in terms of to monitor those negative cases. Then the next question is regards to 27 September. So this is actually, although we implemented it on the 27th September, rest assured the function, we have been giving the reports every day in terms of detection, etc. Why? Because our public health intervention already started much earlier. And the state at that point of time also have issued closure of markets and etc. So from the state office, then the army actually helped us in terms of strengthening the border, those who are party and etc. So strengthen the border has been done. And we have 98 roadblocks before announcement. So during that 1 week before election, we already have the roadblock in place. The only difference is that we have not announced it, but activity already been done at the ground level. So I give example, we already deploy our doctors to Sabah and Sarawak. So Sabah and the 4 districts. We also deploy some of our equipments and all that. So we already send our equipments, PPE and what have you in the certain areas. So activities has been done at that point of time. And we also have identified 6 hospitals to be a COVID hospital. There is Hospital Queen Elizabeth Kota Kinabalu, Hospital Dutch of Cairns Sandakan, Hospital Tawau, Hospital Keningau, Hospital Lahad Datu, Hospital Wanita and Kanak-Kanak Likas. So 6 hospitals we already identified, we already top up the equipment because we learned from the past, PPE, glove, everything. And also we deploy our staff to the area. Then if you see the trend here, we also have the MAIPS before, the temporary hospital. So in Sabah, for example, the bilangan katil untuk sakit COVID 552. So the utilization now is 60%. And the beds for ICU 66, utilization 12%. And the ventilators, we have sent ventilators there, 139 ventilators. So we continue to monitor closely, and Dr. Raiza is looking into every hospital in terms of the equipment, and we are monitoring very closely. Then pusat rawatan and quarantine COVID-19 berisiko rendah, like what we did for MAIPS. So we have 7 centers already identified. One Institute Latihan Kementerian Kesihatan Hospital Tawau for 88 patients. Then Penjara Tawau, because for the detainees, we also have the Penjara Tawau, 215 patients there. And then Complex Sukan Tawau, we have restarted, but at the moment we have not enrolled any patient, admit any patient there. Dewan Arena Belia, we have 2 patients there. Dewan Tun Haji Mustafa Lahad Datu, 39 patients. IPD Lahad Datu, we have no patient there. And PPR, Bubul, Area Sempurna, we have 7 patients. So we already plan in terms of the beds for asymptomatic and low risk. The high risk, grade 3, 4, and 5, they will be admitted to the hospital. So the planning already started even before. The only thing is the announcement of a tempo in that region. The reason we did not announce the tempo is that if we announce the tempo, that means we are stopping, we are forcing people to stay at home, right? That's the tempo. So indirectly, we do not want to be seen to stop people to go for election. But we already have the SOP for election, and even those being quarantined, we allow time off for them to go for election. So that it's not an official at that point in time. So on the 27th, we make it everything official. So it's public, visible to the public only on 27. But the activity has been done for the last 2 weeks. So that's why I think you look into our social media, we have sent our doctors, we have sent our nurses, and we sent our staff all to in Sabah even before 27.
So what you're saying is essentially preparations were already done way before.
Exactly. Exactly. So it's not that we have not responded. Otherwise, you won't get the update every day. Right. So the activities has already been done, and we gave you the update in social media as well, press statement every day about the situation in Sabah. So now the additional to it is that on the 27th, because 27 we realized that people are coming home. Now, if you were to implement on the 25th become an issue, you're stopping people to go back to Sabah and then, for election, etc. So we implement midnight of 26, 12 midnight, 1 minute after 12 midnight, then we implemented in terms of the screening. So although we apologize because there's hiccup initially because we did not expect 4 planes, for example, landed in the same time, one plane, about 1,000 passengers, etc. So there were a long waiting queue. But rest assured, it is actually for the interest of the public. So at least that you are tested negative or positive, then we will isolate you. And it's free. So we did not charge anyone, the passenger, for paying 250 ringgit for the test, for example.